On a narrow bridge dividing two nations, thousands of Venezuelans cross the border each day into neighboring Colombia. For Grecia Zavala, the trek is more than a hunt for food or work.
I'm crossing with hope in search of life.
The 32-year-old cancer patient has crossed the border bridge dozens of times in search of life-saving treatment. The only radiation machine in her city doesn't work. As Venezuela's humanitarian crisis worsens, rising numbers are flooding Colombia in search of medical care, straining the country's already weak health system. At the Erasmo Males Hospital in Cucuta, patients are packed side by side in the ER, their care often requiring costly treatments the cash-strapped hospital can't afford.
We handle the emergency care, and beyond that, there is no more we can do.
The daily arrivals include pregnant women, patients with transmittable diseases, and sickly children like 3-year-old Luna, who weighed just 17 pounds when she fled Venezuela.
We had to feed her potatoes, yuca, just vegetables. No matter how much of that, it's not enough to nourish a child her age.
Several million Venezuelans have fled in a burgeoning refugee crisis, sounding alarm bells throughout Latin America. Some so desperate they're willing to sleep on Colombia's streets.
My mom is sick and needs medicine we can't get in Venezuela.
Grecia Zavala and her husband have spent the last 4 months seeking the required authorizations to get treatment for her cervical cancer. The rubber tires of her wheelchair so worn down they're about to break apart.
I don't want my daughter to be left without a mom.
Her doctors in Venezuela performed a hysterectomy last year, but were unable to provide chemo or radiation. On a recent afternoon, they finally got the green light to begin Zavala's treatment.
Since I crossed the border in search of help, this was my dream. For me, this moment is the start of a dream.
One more hurdle crossed in a fight for survival. Christina Armario, The Associated Press.